In our first and second season of Facilitated Sessions, we talked about a variety of tools that all of our medical students can put into their toolkit to get through some of these kind of hardships that we will encounter from time to time during medical school. So DT, we see that during our first year, our strategy is very important for our success. And that carries over into year 2, the remainder of medical school, and then into residency and practice, right? And so what we're trying to gain here is an understanding of, one, first yourself. This is that identity piece, right? What are the tools that work for you? You have to be very intentional in picking these things, and they have to be very consistent in your practice because you want this to be your default. You want these tools to come into play almost as an autopilot. They kick in as autopilot when certain things within the medical school context starts to come up. So stress, increased workload. Now we're at the middle of the year. Some of the more vigorous, modules are coming up now. And so we need to be able to have these tools in place so this way they can be a default, the autopilot. Now, we talked about some of those things, as we mentioned, GPS. That's from season 1, season 2 of FS. We also talked about journaling. We talked about mindfulness, which we will get into in a little bit more later. But some of these things need to be a cornerstone of our practices for wellness.